Teddy, rag, ice pack, medication. Oh yeah, something to drink.
Fever at home? When your child has a fever, it can be so scary, and a natural instinct is to want to get that number down. But what matters most isn't really the number. And the good news is that fever can usually be managed at home with some simple measures. Let's talk. Pocketbook Paediatrics. Hi, and welcome back to Pocketbook Pediatrics. I'm Dr. Richland, and as usual, I'm always so happy to have you here. So let's get straight to it. Today, we're going to be talking about fever again, but we're going to be talking a little bit more about what's really happening when your child has a fever and what are the things that we can do to manage this at home. And it's important because when we know what's happening, we understand how what we're doing is actually helping or harming. So let's talk a bit. What's happening when your child has a fever? So if you remember, we said it's protection, not harm, right? Because it's your child's body's way of fighting off usually an infection. Yeah, there are other things that can cause fever, but most of the time it's because of an infection. And so the immune system ramps up to be able to fight that off. And that causes the temperature to go up. So fever is not the illness, it's the response to the illness. So when we talk about treating fever, we're not really trying to make the fever go away. What we're really trying to do is make our child more comfortable. Now, you may ask, well, Dr. Brown, is there a temperature that is too high? And the truth is, everybody's body is different. So, what's going to make me uncomfortable is not what's going to make you uncomfortable. And our kids are no different. So, some may have a temperature of 100.4 and they're feeling really lousy and looking really poorly and they don't want to interact at all. And some may have that same temperature and be running up and down as though nothing is happening at all. So, you're going to watch your child and not the temperature. I must say, however, that any child who has a temperature of 40 degrees Celsius, which is the same as 104 Fahrenheit, should at least be checked by a doctor to make sure that nothing else sinister is happening. But most importantly, we're going to check if our child is alert, if they're drinking a lot, if they're interactive, they're not having an excessive vomiting and diarrhea. Usually that's a sign that it's okay to continue treating at home. So, what are the things that we can actually do at home? Very simple things. Things like keeping them cool. So that means that we're going to dress them in light clothing. And for our little ones, probably just in their pamper or their underwear alone. If they're wearing clothing, it means putting them in light cotton, putting them in things that are sleeveless, keeping them just airy and breezy. And not just them in their clothing, but their environment as well. So it means that we're not going to cloak them up inside in a sweater, we're not going to bundle them up under sheets, we're not going to keep them in a warm room. We're going to allow circulation around where they are. And most importantly, we want to make sure that they stay hydrated. So we don't want to force them, but we want to make sure that we're offering them small sips of fluids frequently. And that can be water, coconut water, juice, soup, anything that's going to help them to keep away from getting dehydrated. Now, what we don't want to do is to force that temperature down because remember, we're treating the child and not the number. So when we force that temperature down by cold water baths or putting them directly in front of the fan, what we actually do is sometimes cause a fever to come back higher, or more importantly, we cause our child to be uncomfortable because their body is telling them the temperature needs to be higher. That's the natural response of how fever works. And we're pushing the temperature lower. And so when we do that, the body works even harder to get that temperature back up to where it was before. And so that will keep them in an uncomfortable place. And we don't want that for them. So we don't do those things anymore. Even if your grandmother used to practice them on you, we no longer do those things anymore. Now, the next thing we want to know is should we give medication or not? Because you want to get the temperature down if they're uncomfortable. And that's the answer to the question. We give medication really if the child is uncomfortable. Most fevers, if the child is over 3 months old and under 102 degrees Fahrenheit, can truly be treated without any medication at all and just implementing the simple measures we spoke about before. But if they're uncomfortable or that temperature is creeping up to more than 102, where generally most kids get uncomfortable, then it can probably be beneficial to give some medication just to improve their comfort levels. So, what medication do you give? Acetaminophen is fine to start with. That's your Panadol or your Tylenol. Or you can also use ibuprofen, which would be your Advil or your baby Motrin. Now, can you use both together? Yes, you can because they work in different ways, and so it's okay to give both together. But you do want to give each medication its due. So if you started with Panadol and you realize that, boy, it really didn't seem to shift the temperature as much, your child is still uncomfortable, it's okay to give both at the next dosing. So one thing we must say is that no child under 18 years old who has flu-like symptoms should be receiving aspirin. And this is because it can cause a more serious problem called Reye syndrome, which can affect the liver and other organs. So under 18, no aspirin. So your pocketbook prescription for today is that most fevers can be treated safely at home with very simple measures. And you want to remember to watch your child and not just the thermometer. And of course, if there's any time that you feel uncomfortable, don't hesitate to reach out for help. Thank you so much for watching. I'd love to hear from you down in the comments below. Which of these tips did you know already? Are you in camp medication or no medication? We'd love to hear what you have to say. Thank you so much for watching, and as always, God bless.
You've got this. We've got you.